Hello and welcome to our second trimester class. Whether you're watching this from home or you're here with us in person, we're so excited that you're here and we're happy to have you. Congratulations for finishing your first trimester. You're over 1/3 of the way to meeting your precious baby. We know that pregnancy is definitely not always easy, but we hope that this is a safe place for you to be able to learn more about your own pregnancy, be around others who are going through the same thing, and ask questions in a safe and relaxed place. If you're here in person, as we start going through our topics, please feel free to ask questions. We want this content to be tailored toward your specific questions and concerns. These are a few of the objectives we hope to be able to go through for this class. As you are entering your second trimester, your prenatal visits may start to look a little bit different, so we'd like to talk about what to expect at those visits. We'd also like to touch on fetal movement, as most commonly people start to feel their baby moving in the second trimester. We're going to review some of the common symptoms you may experience and what you can do about those symptoms if they happen, and then briefly going over starting to prepare at home for baby. First, we're going to talk about what to expect at your prenatal visits this trimester. Your doctor will probably start asking you if you've started to feel the baby moving yet. Do not worry if you have not, as this tends to start at different times for everybody. It's more likely to happen a little earlier if it's not your first baby. Your doctor will ask you if you're having any contractions, cramping, bleeding, and vaginal discharge. So these are things to pay attention to and to talk about at your visits. Your doctor will always listen to baby's heartbeat at your visit, and then around 20 weeks or so, we'll start measuring your uterus to make sure baby is growing. Whether you feel like baby's growing or not, your baby is growing tons this trimester. Most people start to notice their baby bump forming. If this is your first baby, that may happen a little bit later, which is completely normal. People may say that you don't look pregnant, but I promise that your bump will be there soon. Baby will grow from about the size of a peach all the way to the size of an eggplant this trimester. Take a minute to take a look and pick out the fruit or vegetable that's closest to your baby's size right now. If you have one of the pregnancy apps on your phone, it probably also helps keep you up to date with how big the baby is in comparison to fruits, vegetables, or sometimes toys. At around 20 weeks, your doctor will start measuring your fundal heights, which is used with a tape measure going from the pubic bone all the way to the top of the uterus, which is called the fundus. This helps us to know if baby is growing appropriately. In a completely normal pregnancy, most women get 1 or maybe 2 ultrasounds. So this is a way for us to know that baby is appropriately growing in between visits. The amount of centimeters that your fundal height measures should be about the amount of weeks that you are. It can be plus or minus 2. So if you're around 20 weeks, you could measure anywhere from 18 to 22 centimeters. But if it's off by much more than that, your doctor will probably recommend an ultrasound to make sure baby's growth is appropriate. This trimester is the time when you'll get to have your anatomy scan, which is the most detailed ultrasound you'll have this pregnancy. Your doctor will probably recommend that we get this scheduled around 18 to 22 weeks to evaluate baby's anatomy. This ultrasound looks at baby from head to toe, including brain anatomy, heart structures, arms and legs, bladder, stomach, and kidneys to make sure that everything is developing as it should. I would plan on about an hour for this ultrasound because of all the things that we're looking at for your baby. If you would like to find out the gender of baby, you can typically find out at this visit if you would like to know. Sometimes the baby might not be in a great position for all of the pictures we need. Some babies are shy and they hide from the camera. So if this happens, your doctor may recommend that you come back another day for an additional ultrasound. This doesn't necessarily mean that anything that we saw was abnormal, just that we didn't get all of the pictures that we need. Next, we're going to review what to expect with fetal movement this trimester. Fetal movement can start to be noticed anytime in the second trimester. It may initially feel like subtle flutters or gas and will progress to more like kicks, rolls, and punches. If this is not your first baby, you tend to notice the movement a little bit earlier because you know what to expect. Fetal movement should become much more consistent around 24 to 28 weeks. Let's review some of the common reasons you might not feel your baby move. It's too early. This is an extremely common reason. You may start feeling those flutters earlier on, but they may not be consistent. Always remember that fetal movement is typically not consistently felt until 24 to 28 weeks. Your baby might be sleeping. Babies sleep often throughout the day, typically in about 20 to 30-minute increments. So sometimes you might not feel the flutters because baby's asleep. You may not have eaten or drank enough today, so baby might need a little bit of blood sugar being risen or you to hydrate in order to move a little bit more. Positioning is another common reason you might not feel movement. It's typically felt more easily when lying down in a quiet place than if you're up moving around where you might be a little more distracted. Placenta position. If your placenta is on the front side of your uterus, also called an anterior placenta, it can make it a little more difficult to feel movements. This doesn't mean anything is wrong. It's completely a normal variation to have a placenta in that spot. But people with an anterior placenta might feel the baby move a little bit later than others with a placenta that's posterior. What should you do if you're not feeling your baby move? If you're before 24 weeks, as I mentioned, fetal movement is typically not consistent, so I would not worry and I would not recommend doing fetal kick counts. However, if you're approaching 28 weeks and you'd like to know what to do if you're not feeling a lot of movement, this is what I would recommend. Fetal movements are a key indicator of baby's well-being, so it's important that we're feeling regular movement past that 28-week mark. I recommend drinking water, eating something, and resting in a quiet place to focus on movements. Lie on your left side if that's comfortable, as a lot of times that will help you feel the baby better. I recommend the count to 10 method. This is when you focus on baby's movement and start a timer when you feel the first movement. You should reach 10 movements within 2 hours. Every movement counts, including small rolls, kicks, punches, or flutters. If you have not reached 10 movements by 1 to 2 hours, or you're extremely worried, always feel free to reach out and call your doctor or visit OB triage. Next, we're going to review some common symptoms that you might start to experience this trimester. Acid reflux, also sometimes called GERD or heartburn, is extremely common during pregnancy. As many as 50% of pregnant women will experience this. You may notice a burning in the chest or throat, stomach pain, frequent burping, or a sensation of food coming up. Other slightly less common symptoms might include a dry cough at night from acid being in the back of the throat, increased nausea in the morning, or a bad taste in the mouth. Let's review why acid reflux is so common in pregnancy. Normally, in a state where you're not pregnant, once food enters the stomach from the esophagus tightens to prevent any backflow. In pregnancy, due to the hormone changes, this opening to the esophagus, which normally tightens after we eat food, is a lot more relaxed, which will allow acid and sometimes food particles to go back up towards the mouth. In addition, the uterus is enlarging from below, which puts a lot of upward pressure on the stomach, which may exaggerate that acid going upward. This makes it hard for the stomach to empty in the normal way that it should. Acid reflux in pregnancy can range from a little bit annoying to extremely uncomfortable. So let's review some ways that you can help manage if you're starting to experience this. Number 1, try to avoid triggering foods. Everyone's triggers may be a little bit different, but some of the common foods that trigger acid reflux are foods that are spicy, greasy, or fried. I also recommend eating small and frequent meals as opposed to a single large meal. This is so that the stomach doesn't get as full and there's less backflow up into the esophagus. Stay well hydrated as this helps neutralize some of that acid. I also recommend remaining upright after eating to allow everything to digest and prevent that reflux from going backward. It's never a good time to eat right before lying down to take a nap or go to bed. If you've tried all of these things and you're still very bothered by acid reflux, feel free to ask your doctor about safe medications that you can take, which can significantly help with your symptoms. Next, we're going to review back pain in pregnancy. This is another symptom that's extremely common. When you start out in your early first trimester, the curvature of your back is pretty normal, as it would be if you were not pregnant. But as you can see, as the baby grows, this curvature in the lower back becomes more and more exaggerated, all the way until this point where it's extremely curved. You can see that the growing baby puts a lot of stress, pressure, and strain on your lower back, which can be a common reason why women have back pain in pregnancy. Alleviating this back pain oftentimes means doing some stretches or exercises that help reverse that pressure that baby puts on your low back. In the top right corner here, you can see that if you go on hands and knees and push your back upward, it's going to help reverse that exaggerated curvature, alleviating some of that pain. Pregnancy support belts can also be really helpful as they help offload that tension on the lower back so that the lower back isn't holding all of the weight of the baby. Next, we're going to talk about constipation in pregnancy. As baby grows, your uterus puts pressure on many places in your abdomen, which can make it a lot more likely to become constipated as stool can get kind of stuck in the bowels. Hormone changes in pregnancy, just like those that cause increased risk for acid reflux, also relax the bowel and slow down digestion. Finally, supplements like prenatal vitamins and iron can also worsen and exacerbate existing constipation. If you're starting to have problems with constipation, I highly recommend talking to your doctor about options because straining and pain with bowel movements typically get worse the longer you're backed up and can also worsen the further along you get in your pregnancy. You should try to eat plenty of fruits and vegetables to increase fiber intake. Stay very well hydrated, and try to limit straining. But there are also many safe medications that can help with constipation in pregnancy. My personal favorite is Miralax, also called polyethylene glycol. It's a powder that you can mix with any beverage of your choice, whether hot, cold, or carbonated. It is not absorbed into the body and stays in the gut, so it's extremely safe and has no risks to baby. You can also titrate this medication to the amount that you need to have soft, non-painful bowel movements. Water retention is extremely common in pregnancy and worsens as you get further along. This can cause women to start having swelling in their lower legs, especially around their ankles. This can be very uncomfortable and get more exaggerated when on your feet for longer periods of time. You can try support or compression stockings, which helps push some of that extra fluid and helps it go upward towards your body instead of staying pooled in the legs. Also recommend elevating the legs periodically and sleeping on your left side at night. If you notice that it's more pronounced in only one leg, or it's associated with other symptoms like redness, severe pain, or shortness of breath, this is not normal and could indicate a blood clot or infection, and it's important to let your doctor know. Round ligament pain is a type of discomfort that occurs in pregnancy due to stretching or pulling of the ligaments which support your growing uterus. This is typically described as lower abdominal pain, which can be on one or both sides, feels like a sharp or pulling sensation, and often radiates down to the groin. These types of pains commonly first start in the second trimester and can be provoked by movements such as rolling over in bed or twisting. If you are experiencing round ligament pain, be reassured that this is a sign of normal uterine stretching and usually gets better and goes away with time. You can try rest, gentle stretches, hydration, Tylenol, and heating pads to help alleviate some of the pain. Pregnancy support belts can also help so that the ligaments of the uterus are not being pulled as much. Although uncomfortable, round ligament pain is not dangerous, so take a deep breath if this happens and be reassured it should pass soon. Braxton Hicks contractions, also sometimes called false labor, can start occurring in the second trimester. This is when the uterus tightens all over like a contraction. These are sometimes painful, but often just something that is noticed but not uncomfortable. These types of contractions can be provoked or worsened by excessive activity or dehydration. Classically, Braxton Hicks contractions are also worse at night. Sometimes Braxton Hicks contractions can be very stressful, and it can be hard to know if we're in true labor or just having some Braxton Hicks contractions. Let's review some of the differences between Braxton Hicks and true labor. First, ask yourself what it feels like. If it is just a tightening of your belly or mild cramping, it's probably a Braxton Hicks contraction. True labor contractions are intense and typically stop you in your tracks or take your breath away. Braxton Hicks contractions will be random over time. They don't have any regular sort of pattern, whereas labor contractions are regular and often get closer together over time. If you experience a Braxton Hicks contraction, you can time it until the next one to see if you're having any sort of pattern or if it's more random. Braxton Hicks contractions respond well to rest, hydration, and position changes. If you find that the pain gets better by drinking some water or sitting down and resting, it's probably a Braxton Hicks contraction. True labor contractions will not get better with Tylenol or rest because true labor will continue progressing toward baby. Lastly, Braxton Hicks contractions are typically consistent and don't get stronger over time. True labor contractions get stronger, more painful, and closer together over time. Lastly, let's talk about starting to prepare for delivery. Although you're only in your second trimester, it's not too early to start thinking about what you want your birthing experience to be. The most important thing I'd like to emphasize is that your delivery experience and plans for baby are entirely your own and don't belong to anybody else. Preparing for delivery of a new baby is extremely exciting, but also can be scary and nerve-wracking. For many, the experience of labor and having a baby is an unknown, and we are unsure what it will be like. Talking about your plans for labor and delivery can help make the process less intimidating and help you better know what to expect. This is something you can talk about with friends and family, but also do not hesitate to talk to your doctor about your wishes. This way your doctor can help make your experience everything you want it to be. Some of the things I would recommend thinking about include pain control, positional preferences, who you would like in the room with you, if you intend to breast or formula feed, and who will be your baby's doctor. We know that sometimes this can be overwhelming, so we are here if you have any questions about what delivery will be like and what some of your options are. We hope that this has been a helpful overview of your second trimester. We welcome any questions, comments, or experiences that you would like to share.